Jason Miller always thought the worst part of a heart attack would be the pain. He was wrong. It happened on a Tuesday night in July. Jason was 45, a high school basketball coach in Ohio, healthy enough, never smoked, the kind of guy who still ran drills with his students. At 9:14 p.m., while making a sandwich in his kitchen, he suddenly collapsed. His wife, Dana, heard the noise and found him on the floor, barely breathing. She called 911 immediately. The ambulance arrived in 6 minutes, lights flashing and sirens cutting through traffic as paramedics rushed Jason to the nearest hospital. Doctors discovered blocked arteries and performed emergency surgery that same night. Later, the cardiologist told Dana something simple but chilling. If Jason had arrived 10 minutes later, he probably wouldn't have survived. Jason eventually recovered, slowly and painfully, but he lived. 3 weeks later, the bill arrived, $42,870. Not for the surgery, for the ambulance. Dana called the insurance company, certain it had to be a mistake. The representative calmly explained the issue. The ambulance company was out of network. Dana said, "He was having a heart attack. We didn't choose the ambulance." There was a brief pause on the line. Then the representative replied, completely serious, "You could have requested an in-network provider." Jason had been unconscious on the kitchen floor, but apparently he was still supposed to check the network first. Daniel Brooks had worked at the same warehouse job for 15 years. Through that job, he had health insurance, and every paycheck, a portion of his salary went straight toward his coverage. Daniel rarely used it, until one winter night when he slipped on ice outside his apartment and shattered his ankle. The injury required surgery and months of physical therapy. The recovery was slow, but eventually Daniel was able to walk again and return to work. Then the hospital bills arrived. Nearly $92,000. Daniel wasn't worried. He assumed insurance would handle most of it, but weeks passed and the balance never changed. Confused, he called the insurance company. After checking his file, the representative gave him the news. His claim had been denied. Daniel asked why. The representative explained that the hospital had submitted the claim 31 days after the procedure. According to the policy, claims had to be filed within 30 days. Daniel sat there stunned. 15 years of paying for insurance, and the one time he actually needed it, it was denied because someone was one day late. Laura Simmons had always been responsible with her finances. For nearly 15 years, she paid for a comprehensive health insurance plan through her employer. The monthly premium wasn't cheap, but she believed it was worth it for the peace of mind. One morning, Laura woke up with severe abdominal pain that kept getting worse. After hours of suffering, her husband drove her to the emergency room. Doctors ran tests and quickly discovered that her appendix was dangerously close to rupturing. They rushed her into surgery that same night. The operation went smoothly, and doctors told her that if she had waited even a few more hours, it could have been life-threatening. A few weeks later, Laura received the hospital bill. It totaled $78,000. Like most people, she assumed insurance would take care of most of it. But when she checked her account online, the claim showed one word next to it: denied. Laura called immediately, thinking it had to be an error. After reviewing her case, the insurance representative explained the reason. According to their review board, the surgery had been classified as not medically necessary. Laura was stunned. The doctor had told her the surgery prevented her appendix from rupturing. But to the insurance company, since it hadn't ruptured yet, the surgery wasn't considered necessary. Anthony Carter had health insurance through his job for nearly 10 years. Like most people, the payment was automatically deducted from his paycheck, so he rarely thought about it. It was just something you had in case life went wrong. Then one Friday night, life did. Anthony suddenly felt a strange numbness on the left side of his body, and his speech started to slur. His wife didn't hesitate. She rushed him straight to the emergency room. Doctors quickly confirmed he had suffered a mild stroke. They treated him immediately, gave him medication to prevent further damage, and kept him in the hospital for several days while he recovered. Thankfully, Anthony survived and slowly began getting back to normal. But about a month later, a letter arrived from his insurance company that changed everything. His claim had been denied. Shocked and confused, Anthony called the insurance company right away. The representative calmly explained that his employer had switched insurance providers that same week. His previous policy had officially ended at 11:59 p.m. on Thursday night, while the new policy didn't begin until 12:05 a.m. on Friday. Anthony checked the hospital records again. He had arrived at the emergency room at exactly 12:02 a.m., right in the middle of that 5-minute gap, which meant, according to the insurance company, that at the exact moment he suffered a stroke, Anthony Carter technically had no insurance